If you're a med student, head to mosaic.org for free medical study notes and resources from other med students from around the world. Welcome back to another mosaic.org tutorial. Today we're going to be talking about the sphenoid bone. Now the sphenoid bone is an unpaired bone in the skull, and it contributes to the neurocranium, which is the cranial vault, and to the viscerocranium, which is basically the face. It has several important functions, mainly in the middle cranial fossa. It provides part of the floor, and it provides the area that the pituitary is able to sit in, the pituitary fossa or the sala turcica. It is the boundary for the anterior cranial fossa. It's the posterior boundary. And outside of the skull, I suppose, looking at the skull laterally, it contributes to the pterion. It contributes to the medial wall of the orbit. And it contributes to the posterior roof of the nose. And then looking at the base of skull, it contributes to the infratemporal fossa. Now it's got four parts. It has a body, and connected to the body there's a greater wing and a lesser wing. And it's actually the lesser wing which is on the top. And then finally it has a pterygoid process attached beneath. So people describe it in isolation as looking bat-like or wasp-like, or like a biplane. Like a biplane because it's got lesser wing, greater wing, and then these two processes. So I'm going to show you those in the skull now. Alright, so we're going to try and demonstrate some of those things to you now. So looking here, this is the anterior cranial fossa, and you can see that the posterior boundary of it is the lesser wing of the sphenoid bone. And as we move into the middle cranial fossa, you can see that it's the floor of the greater wing of the sphenoid, which is providing a lot of the surface of the floor, as well as the temporal bone. And you can see that the sala turcica here, which houses the pituitary, is obviously very prominent in the skull, and that originates from the sphenoid bone as well. Posteriorly in the skull, it's the basi occiput and the petrous portions of the temporal bone that the sphenoid bone is interfacing with. If we flip it over, you can see that just here, it's not very good because of the lighting, but just here, this section along here, this is the, and just here, these are the pterygoid plates, and this is the pterygoid process, which is a kind of common attachment from the body of the sphenoid bone.